October may be well known for autumn colors, of course Halloween, but this month also marks an important time dedicated to spreading awareness about breast cancer. Breast Cancer Awareness Month. And during this month, the healthcare community comes together to educate and support those diagnosed with this disease. Joining us is Dr. Sarah Schwertner from Primary Care Plus to explain a bit more. Good morning to you.
Good morning.
What happens to your body when you have breast cancer?
So whenever you have breast cancer, there is cells that divide and they can grow into tumors and it can spread to the rest of your body.
And this, you know, we think of breast cancer, we think of women.
Right. So it's more common in women. It's actually about 100 times more common in women than men. And 1 in 8 women have the chance to develop breast cancer.
So before we get to the men part, because it is something that does affect men, but is family history, or who's susceptible or most susceptible to breast cancer?
So if you have a first-degree relative who has had a history of breast cancer, which would be a sibling, a parent or grandparent, then you are twice as likely to develop breast cancer.
What are the symptoms?
So one thing you want to look for in the breast tissue is if you have an abnormal lump, a dimpling. Sometimes people can experience pain in a certain region, but that's not necessary, or unusual nipple discharge. Those can be signs of breast cancer.
Okay, let's go to men for just a minute, because as I said, we think about this as a women's disease. Obviously, that's where most of the focus is, but men can get it.
Men can get it. It's pretty rare. It's about 1% chance, 1 out of 100. But if there is something abnormal in the chest region, you should go see your primary care doctor and get it checked out.
And we're not violating any HIPAA thing or anything, but you have experienced men who...
I have had a patient, even though it's 1 in 100 chance, I have had a male patient who did have breast cancer, stage 4.
Stage 4. All right, well, let's delve into the stages. What do they mean? And
so the stages can be anywhere from 1 to 4, depending on the size of the tumor, if it's spread to any part of the body, and that's when we look at what type of treatment plan that a patient may need. If you catch it early, it's like anything else. Obviously, your odds are much better. Yes. So the American Cancer Society recommends that women at the age of 45 start to get mammograms once a year. However, over the age of 50, if you've had normal mammograms, you can spread it out every 2 years. Now, what if you've had a mother or a grandmother or a sister who's had it? Does that mean you should approach this differently in any way? Yes. So if you have had a first-degree relative who's had it, and you want to look at what age they were diagnosed, and if it's 10 years prior to that is actually younger than 45, then you want to start getting your mammogram screenings then. And then, Dr. Schwertner, you can't really prevent it in that sense, but what do you do to try to prevent it? We don't really have enough research about prevention, but there are things you can do, healthy lifestyles, such as eating a lot of fruits and vegetables, exercising 30 minutes a day, 5 days a week. Those kind of things can prevent breast cancer. Some of those things we hear so much about to help promote heart health, diabetes, stroke, all that, everything. All that other stuff. Yes. It's all kind of related. Dr. Sarah Schwertner, thank you so much. Thank you.